Now, I know there are a few of you in the audience who are thinking about veterinary medicine, right? Which is such an honorable profession. So we're going to introduce you right now to an amazing doctor and friend of mine, Dr. Gary Richter, who, by the way, has been named has been named America's favorite veterinarian. He's certainly my favorite veterinarian, and he's an amazing man. He's a certified veterinary acupuncturist and certified veterinary chiropractor. As owner and medical director of Montclair Veterinary Hospital, Dr. Richter understands the benefits of both conventional and holistic treatment methods. His professional goal is to provide a center where pets can receive effective holistic therapies in conjunction with traditional treatment and care from their general practice veterinarian. So please, let's give a huge hero's welcome to America's favorite veterinarian, my friend, Dr. Gary Richter.
Sir. Hi, everybody, and thank you. It's great to be here. What a great crowd. How many people in the room are thinking about a career in veterinary medicine? That's a lot of people. That's fantastic. So I want to talk about that today, and I also want to talk in a bit of a broader sense about integrative medicine overall. And what I mean by that is taking Western medicine and complementary and alternative care and combining it to wind up with a better outcome for our patients. But let's talk about a broader topic for the moment. And what I want to ask is, why do we even practice medicine? What's the point? Well, in the big picture sense, we do it to diagnose, prevent, and treat disease. More philosophically speaking, we're looking to extend life, and we're looking to preserve quality of life. That's really why we do what we do, because at the end of the day, no matter what type of medicine you practice, what you do will change lives, and change lives for the better. So having said that, let's talk for a moment about a career in veterinary medicine. It's interesting, a lot of people don't really think about it, but as a veterinarian, you are trained to practice medicine on every animal on the planet except for one. That gives you a pretty broad range of professional options. And as a veterinarian, you have the opportunity to work in private practice, in academia, in research, government, the military, etc. There's so much you can do. And what you want your practice to be is completely up to you. You can focus on a very narrow thing. You can be a neurosurgeon, or you can focus on much bigger public health issues, food safety issues, anything that you want as a veterinarian. And this certainly includes both complementary medicine as well as Western medicine. All of these things fall under the purview of being a veterinarian. And one last thing to note here, in case you haven't given it much thought, the process to become a veterinarian, educationally speaking, is very nearly the same as that of medical school, in the sense that all of the science, all of the pharmacology, et cetera, you're learning, it's all the same. There's just differences in anatomy and physiology. When we look at modern medicine, there's a couple of different facets of medicine. There's research, there's the laboratory sciences, there's imaging, so X-rays, CT, MRI, pharmacology, surgery, and for cancer patients, radiation therapy. Now, as a doctor, when I look at any type of medicine, any form of medicine, I always look at it with a critical eye. And so when I look at modern conventional Western medicine, that's exactly what I do. So I look at modern medicine and I say, what are the strengths? Well, it's really good at diagnosing disease. It's outstanding at acute care. If you've ever seen a level 1 trauma center, you know what what kind of things modern medicine can really do. Similarly with surgery, the things that can be done with surgery now are unbelievable. And perhaps the one thing that has saved more lives than any other form of medicine is actually vaccinations. All that said, there are things about modern medicine that it has some trouble with. It's not very good at chronic things, chronic disease, chronic pain. These are things that modern Western care can sometimes have trouble with. Similarly, preventative care. With the exception of vaccines, the modern medical paradigm is not particularly focused on prevention. In fact, it tends to be more of a reactive system than a proactive system. And lastly, and I really want to highlight this one last thing, is non-specific illness. Think of modern medicine as kind of like a sharpshooter. It needs a target. If there is a disease process that we can't put a name to, if we can't put a label on, medicine's going to have a hard time treating that. And that's just important to realize what the shortcomings are of this type of medicine. Now, as a 21st century physician or veterinarian, you basically have these three big tools in your toolbox. You have pharmaceuticals, you have surgery, you have radiation therapy. And if you're not familiar with this book here, this is the physician's desk reference. So this is a comprehensive listing of every pharmaceutical that is available today. And so the question that I want you to think about as a future doctor is, what happens when all of your tools in the toolbox don't fix your patient? What are you going to do? What are you going to tell your patient or your patient's family? Because I promise you that as a doctor, you will face this issue. So stick a pin in this for a moment. We will come back to that question. But first, let's talk about what did people do before there was modern medicine? You might not realize that modern medicine as we think of it today is really barely only even 100 years old. And for tens of thousands of years before that, people had to figure out how to get by. People had to figure out how to survive. If you got sick, it wasn't just that you laid down and died. People had to figure out how to do something. And how is it that anybody figured out how to survive until the age of modern medicine? Well, the answer to that is that every indigenous culture in the world developed its own form of medicine. And they did that using what they had available to them. For example, the Chinese developed acupuncture. And nearly every culture in the world developed some form of herbal therapy. And herbal therapy was developed from the resources that these cultures had available to them, the plants that grew in the area where they lived. Now, there may be some of you out there thinking right now, okay, so this guy's about to tell me that all these roots, nuts, and berries are going to be used to treat disease. What a joke. So let's look at that for a second. This is a short list of some of the modern pharmaceuticals that are directly derived from natural substances. Let's go through these just real quick. Silymarin is a liver protectant drug. It's made from milk thistle. Digoxin's a cardiac medication. Morphine for pain. Artemisinin is currently being used to treat pharmaceutical-resistant malaria. Blood thinner, chemotherapy agent, anti-inflammatory, antibiotic. Atropine is used to control heart rate and anesthetize patients. L-Dopa treats Parkinson's. Scopolamine can treat motion sickness. Another chemotherapy agent. Pseudoephedrine is used in cold medicine. And lastly, Epidiolex, which is used to treat certain forms of refractory epilepsy in children, is derived from cannabis. All of these different pharmaceuticals directly from the natural world. There are many things that we can learn from natural compounds. So just like I do with Western medicine, I'm going to look at complementary and alternative care with the same critical eye. Complementary and alternative medicine has a couple of shortcomings. It doesn't really diagnose disease in the way that we as Westerners think of diagnosing disease. It's also not great at acute care. You certainly can treat acute problems with complementary and alternative care, but nowhere to the extent of what Western medicine can do when there's severe trauma or infection. And there's really no such thing as surgical intervention or vaccines as it pertains to complementary and alternative care. However, complementary care is really good at chronic stuff, chronic disease, chronic pain, great at controlling those things, really great at preventative care. And why? Because when you're treating with natural compounds, frequently what you're doing is you are supporting the body as a whole, you're supporting the immune system, and therefore not only are you treating disease, but you are preventing disease. Similarly, complementary care is really good for nonspecific illness as well, because again, when you're supporting the body as a whole, you don't necessarily need to have that pinpoint target that Western medicine does. Now, when you look at this list of strengths and shortcomings, it might look a little familiar because it is the exact opposite of the one that we talked about for modern medicine. And therein lies the rationale for integrative care. It makes perfect sense. They fit together beautifully. When you practice medicine, just like when you do anything else in life, it's really important that you use the right tool for the right job. So see if you can finish this sentence for me. If all you have is a hammer, everything looks like a nail. So the point is that you can only use the tool that you have at hand. Anybody ever tried to do this? Of course you have. We've all done that. So, use a kitchen knife as a screwdriver, right? So here's the reality. Sometimes it works, and sometimes it doesn't, and sometimes you break the thing that you're trying to fix. And it's one thing if you're trying to screw in a screw, and another thing if you're trying to save a patient's life. When we're practicing medicine, frequently we need more than one tool in the toolbox, pharmaceutical, surgery, radiation therapy, etc. And let me tell you one other thing about medicine that you may not have realized yet. Like many other things in life, practicing medicine is following an algorithm. Your patient comes in with these symptoms. You run these tests. Based on the results, you offer these treatments. Based on the response to treatments, you run other tests or offer other treatments, and so on and so forth until you get to the end of the algorithm. Now let's return to the question I asked you before. What happens when you run out of options? What happens when there are no more treatments in the algorithm and you've run out? What are you going to tell your patient? This is a very, very difficult and very real-world moment that you will face as either a physician or a veterinarian. A lot of people that practice Western medicine look at the pharmaceuticals and the surgery and the radiation therapy as the entire library of what medicine has to offer. And I'm here to tell you today that Western medicine is not the entire library. It is but one book in a much, much larger library. And these books contain all kinds of scientifically validated and accurate and usable information that you can use in your medical practice if you just care to look. What I want to leave you with today is not that you should be thinking outside of the box. What I want you to understand is that there's more than one box. There's lots of boxes if you just care to look. So again, use the right tool for the right job. Use your Western medicine tools, but also explore other alternative therapies. To be clear, I'm not suggesting that anybody needs to be an expert in all of these different fields any more than as a physician or a veterinarian, you're supposed to be an expert in surgery, internal medicine, oncology, neurology, etc. Nobody can do that. But as a doctor, your job is to get your patient in front of the person who can treat them the best. It doesn't have to be you. It doesn't have to be me. The best thing you can do for your patient is get them from where they need to be so they can get from A to B quicker. At the end of the day, your success in both life and in your professional work is very much closely linked to happiness. And if your patients are living longer and better lives, and your professional life is described as somebody who is constantly exploring a lifetime of learning, a lifetime of intellectual stimulation, if you're always looking for that next best way to serve your patients and to help them live better, then I promise you that you will be both happy and successful in your professional careers. Because I can tell you, when all is said and done, when this comes to you, there is no more rewarding feeling. There is no greater reward as a doctor when you know that you have saved a life, when you have transformed the life of an individual and the life of a family. So, as you take your next steps towards your career in medicine, let me leave you with this. Always remember that your first responsibility as a doctor is to your patients. And if your goal is to help them live longer and better lives, it is important to think critically and keep an open mind towards what is out there as far as treatment. And always remember that the scope of medical practice is much, much larger than many people realize. Thank you.